Gastric bypass surgery is both a restrictive operation and a malabsorptive operation. That is to say that not only do you eat less, but you also don't absorb quite all of the nutrition from what you do eat.
It involves actually disconnecting the stomach from the intestines and making a small little pouch, and your food enters that small little pouch, bypasses a part of your intestines, and then passes through the rest of the way in a normal manner.
Gastric bypass is considered to be a cure for diabetes. And most of my patients that come into surgery, by the end of the 3rd month, they're off insulin, they're off blood pressure medication.
I needed something more than the lap band. The lap band is more for restriction, and I needed something because I was already pre-diabetic, so I needed something to control the way that my body absorbed the food that I ate. And like I said, I was 425 pounds, so I needed something drastic.
I examined all of the procedures, and I know myself, and I know the type of eating habits and patterns that I have. I know what a huge sweet eater I was. And I wanted a procedure that would offer me the best assistance at controlling those identified behaviors that I had. Gastric bypass does have, as one of its side effects or complications, dumping syndrome, which refers to the dumping of high sugar, high fat foods into part of the intestine that's not used to receiving those. When that happens, it sets off a series of biofeedback type mechanisms with their symptoms, and you really feel miserable. So you have a physical deterrent that's in there to keep you off of those sugar foods.
I just think in terms of long-term results, there's a better success rate with gastric bypass. So I approach this as a lifetime, long-term effects. You know, I didn't want something that might work for a while and then gain it back, and I was afraid I could make my own adjustments to the lap band, so that's why I went with gastric bypass.
There was such a huge success rate with the gastric bypass, and I wanted to be one of those success stories.